Beginning Monday, international travellers to the United States, regardless of vaccination status, must produce a negative PCR COVID test within 1 day of departure, down from 3. According to the Centers for Disease Control, the reduced time frame aims to provide less opportunity to develop infection prior to arrival in the U.S.
All inbound international travelers must test within 1 day of departure, regardless of their vaccination status or nationality. This tighter testing timetable provides an added degree of protection as scientists continue to study the Omicron variant.
The new measures come as travel restrictions that went into effect a week ago targeting South Africa and several neighboring countries remain in place, but with a caveat. The U.S. President's chief medical advisor, Dr. Anthony Fauci, telling a local news network that the administration felt very badly about the hardship that might have been put on South Africa and the other regional countries caught up in the latest travel policy. And while he pointed to Omicron becoming the dominant variant in South Africa, he also noted there was no current evidence to suggest it caused more severe illness than other variants, as they now await further scientific data in that regard. He said they were reviewing the policy on a daily basis and hope to lift the Southern African ban within a reasonable amount of time.
The restrictions were recommended by our health and medical experts for neighboring countries. These steps were taken in order to slow the spread of the variant and to give our medical experts here more time to assess this variant and more time to assess what we needed to do to protect people in the United States. At the same time, we have been donating not only vaccines, but know-how and expertise to South Africa, to neighboring countries, and we've been in touch with officials there on a daily basis as we help to work to address this variant and this virus. And we are assessing on a daily basis what is needed, whether it's adding additional restrictions or removing restrictions.
With growing condemnation of the restrictions, including from the United Nations chief Antonio Guterres, who in a tweet warned that travel restrictions that isolate any one country or region are unfair, punitive and ineffective. And with the Omicron variant now present in at least 17 states, from California to New York, economic uncertainty is growing.
We're very uncertain at this point just how significant a threat it's going to be, and closely, watching the scientific evidence on this that's accumulating. But hopefully it's not something that's going to slow economic growth significantly. But, the Delta variant did unexpectedly prove this fall to really cause some problems. We saw a severe slowdown in economic growth in the United States on account of it. It could depress demand and cause slower growth, which would impact inflation the other way. There's a lot of uncertainty.
The USA has hit an average of 109,000 cases daily, the highest daily caseload since October 1st, while the 7-day average for daily deaths is at 1,100. And with the winter months approaching, officials here believe those numbers will rise. Sherwin Bryce-Pease, SABC News, New York.
Well, Sherwin Bryce-Pease joins us now from New York. Sherwin, a very good evening to you. Thank you so much for joining us. Welcome to Full View.
Simpiwe, good to be with you.
Well, U.S. officials, Sherwin, maintain that there's still no cause for panic in the country, despite Omicron now being present in a growing number of states, 17 at last count.
Yeah, and despite the fact that these travel restrictions placed on South Africa and other Southern African countries remain in place, but Dr. Fauci on a number of interviews over the weekend, including on CNN, Simpiwe, talking about that this far the signals are a bit encouraging regarding the severity of Omicron, but again, you've got to hold judgment until we get more experience. And what scientists are saying is, about a week ago, they needed about 2 weeks to really verify the transmission rates around Omicron to see how virulent it is, the levels of hospitalizations, the levels of severe illness. These are factors that scientists have still not fully come to terms with. But the indication certainly from Fauci, who is the president's top medical advisor, is that they are looking at the travel restrictions on a daily basis and that they are hoping to lift them in the near term. What we are also hearing, Simpiwe, from the CDC, the Centers for Disease Control Director, Dr. Rochelle Walensky, is that the dominant variant in the United States is not Omicron, but Delta. Delta is still accounting for 99.9% of new cases in the United States. And what we are seeing from cities like New York City, of course, one of the epicenters of the pandemic around March and April of 2020, they are now strengthening their vaccine mandates. This was announced by Mayor Bill de Blasio earlier this morning. This is what he had to say.
We now are going to deepen that effort by requiring all employees and patrons to have from 12 years old and up 2 doses. And that will take effect on December 27th. Because the idea is everyone by that point who has gotten their first dose, if you've gotten your first dose by now, you're going to be able to get your second dose by then. We got to up the ante here. We want to also encourage folks to get that second dose. Vast majority of New Yorkers do, and that's good news. But we've got to encourage people even more. Get that second dose, because that's what gives you so much more protection. So 2 doses for all the key to NYC businesses starting December 27th, employees and customers.
Good to remember, Simpiwe, that New York City had a vaccine mandate in place for all indoor dining, entertainment facilities, theaters and the like. You needed to show proof of 1 vaccination shot. Essentially, that is now moving to a 2-shot. And of course, if you get the J&J, which is a 1-dose vaccine for fully vaccinated status, that will also suffice. So really an effort here from the city of New York to tighten their vaccine mandates. But this also comes in the context of 2 federal judges putting a halt on similar federal mandates as it applies to health workers and to businesses that employ over 100 people, essentially blocking the Biden administration's efforts here to impose these national federal mandates in terms of vaccinations. And of course, the legal process still needs to play itself out here.
Well, it may be good news at that end, Sherwin, and while we await clarity on the transmissibility of the new variant and its impact on health, hospitalization and such, growing concerns around the economic fallout, I suppose, not just in Southern Africa, but in countries like the United States, that is driving what has been an uneven global economy to date.
Yeah, you heard a little bit there from Janet Yellen, the U.S. Treasury Secretary. And I think, when you look at the World Economic Outlook reports that come out about twice a year from the International Monetary Fund, tucked in there in between the language is that this will all depend, all the predictions, if it's about growth rates, it depends on the trajectory of the pandemic. And as we have seen, the Delta variant a few months ago really stymieing what was supposed to be a precipitous growth rate, certainly driven by countries like China and the United States, and of course Delta putting a spanner in the works. And the concern now is, what sort of confidence can economists present given the unknowns that still surround the Omicron variant? We heard from Kristalina Georgieva, the IMF managing director. This is what she said.
Even before the arrival of this new variant, we were concerned that the recovery, while it continues, is losing somewhat momentum. Why? Because of slowdown in the 2 countries that are engines for growth in the US and in China. And because the Delta variant proved to be a disruptance, it caused some additional delays in production. So let's be very frank, a new variant that may spread very rapidly can dent confidence, and in that sense we are likely to see some downgrades of our October projections for global growth.
So, Simpiwe, what do economists and scientists both like, right? They like predictability, they like certainty, and they like confidence. What do they both not have right now? Certainty, predictability, and confidence, Simpiwe.
All right, Sherwin, great chatting to you. Thank you so much for your update. That was our U.S. correspondent, Sherwin Bryce-Pease, joining us live from New York.